Hi, this is Dr. Andrew Campbell. I'm going to give you Brain Part 2, the effects of molds and mycotoxins. And as all my lectures and all my presentations and webinars, medical and scientific evidence is what all of them are based on. So here's what I do. I'm the editor-in-chief for 4 journals. I'm on editorial boards, all this, and this is just part of what I do. I see patients. I travel to all kinds of countries to lecture at medical conferences. I've published over 100 studies. I have chapters in medical textbooks. And I am not one of those famous doctors on social media who's never published anything except for a book on Amazon or anything like that. I'm the actual real expert in this field. So this was part 1, just brain facts, molds in children, mycotoxins in pregnancy, mycotoxins in infants and children. Very, very important, these two. How they cause learning disabilities, behavior issues, ADD, autism, and how you treat it, because all of these are treatable and you get well again, and adolescence and hormones. So here we go. Part 2, chronic fatigue, fibromyalgia, anxiety, depression, sleep disturbance, multiple sclerosis, optic neuritis, Alzheimer's disease, Parkinson's disease, amyotrophic lateral sclerosis, and of course, important treatment. And what is the key here is always don't treat symptoms and don't treat a lab result. Oh, the lab says that you have this. And you never ask the question, did you have these and these and these and these symptoms? No. Oh, we're going to treat the lab test. I'm so sorry. That's not practicing medicine the way it should be. So first, detect the cause. Second, remove the cause. And third, repair the damage. Here's a big medical secret I'm going to let you in on. So in my patients, and I've seen about not quite 17,000, well over 16,000 patients treated over the last 30 some odd years for molds and mycotoxins. If you have the right diagnosis and the right treatment, the patient gets well in about 6 months. If you have the wrong diagnosis and or the wrong treatment, and you put these on binders and whatnots and cholestyramine, and they stay sick for months and months and years. That's not the way to go, folks. So what can I tell you about molds and mycotoxins? Molds multiply quickly, and as they multiply, they release spores, and the spores carry mycotoxins. It's like a key on a keychain. The two go together. So another important point is a mold that produces mycotoxins doesn't produce one mycotoxin. It's not 1-to-1, okay? It is different than that. One mold can produce a whole series of different mycotoxins. Important to remember. And here's some medical facts. Spores of toxigenic fungi contain mycotoxins. Mycotoxins associated with spores are likely to be absorbed by the respiratory tree and then translocated to other sites, producing all kinds of symptoms. Look at the dates on these, 1987, 1989. This is nothing new. It's new for all those people who want to be, I call them the wannabes, wannabe experts. They all have something to sell. Buy this kit, buy that kit. So I can tell you that these are some more facts. Hair is 100 microns. Spores are about 2 to 4 microns. Mycotoxins 0.1. So 0.1 is basically the same size as the COVID virus. By the way, have you ever heard of a COVID virus being tested for in urine? No. But mycotoxins, yeah, that's the problem. Okay, let me give you some more information. So inflammation that we talked about right here, okay, that these spores go out there, cause all these types of problems. Autoimmune diseases, Alzheimer's, pulmonary cancer, cardiovascular, arthritis, diabetes, neurological problems. And let's talk a minute about the brain. The brain is essentially the only organ that's completely surrounded by bone, okay? Having said that, it weighs 3 pounds, but uses 20 to 30% of the calories that we consume. It's only 2% of our body weight. And from the carotid arteries in the front of your neck and the vertebral arteries in the back of your neck, it gets the most oxygenated blood being pumped out of the heart. Well, what does that all mean? Brain uses 20% of the oxygen as well. And how much blood flows through the brain by hour? 13 gallons. 20% of all the blood pumped by the heart. And there's over 400 miles of blood vessels. Can you imagine? Yeah, every cell, all of them, needs blood, needs oxygen, needs nutrients. Okay, there's 100 billion of them. Every person's thoughts, memories, emotions, actions, and reactions are in the brain. So where do mycotoxins first affect the body? In the brain. Okay? And that's the overwhelming medical and scientific evidence, regardless of what these so-called wannabe experts say. Mycotoxin antibodies destroy brain cells by dysregulating the mitochondria and causing cell death, which is in medicine called apoptosis. And they destroy the blood-brain barrier. So all these things you see on the internet about mitochondria, help fix the mitochondria and all that, it's not going to get fixed unless you take care of the mycotoxins first. Remember this slide that I gave you. First, detect the cause, remove the cause, repair the damage. Okay, so now that you know and you're in on all these important points, you can tell whoever you're seeing to follow and do the correct things. Here's a healthy brain scan. This is by Dr. Daniel Amen, who I've known for decades. Wonderful man, developed SPECT scanning of the brain, an incredibly important tool. And here it is, healthy brain scan on the left, toxic one on the right, obviously very different. So what are the neurological effects of mycotoxins? Autism, decrease in short and long-term memory in kids, optic neuritis, we're going to talk about all this, chronic inflammatory demyelinating polyneuropathy, loss of balance, facial pain, ALS, which is amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, Alzheimer's disease, multiple sclerosis, movement disorders, Parkinson's disease. What is frequently misdiagnosed? Okay, oh, you have fibromyalgia. We're going to give you all this supplements. Oh, you have chronic fatigue syndrome. No, you don't. You're suffering from molds and mycotoxins. What about, oh, you have chronic Lyme. You're going to be on antibiotics, IV and oral for years. Oh, really? No. Depression that is resistant to antidepressants, anxiety disorders, autoimmune diseases, POTS, dysautonomias, demyelinating disease. And that includes, by the way, Guillain-Barré syndrome. So here are the symptoms. These are pretty typical of patients suffering from molds and mycotoxins. This is from a textbook in medicine, by the way. It was written, published 20 years ago, this year. So it's not new. Here's a study And this shows that chronic fatigue syndrome, fibromyalgia, various types of hypersensitivities in very sensitive patients, allergies, food intolerance, sensitivity to chemicals at concentrations tolerable by most people, sensitivity to electromagnetic fields, EMF, may be associated with mycotoxins. And at the last part, look at the silicone breast implants. Yes, folks. I've authored 23 studies on the effects of silicone breast implants. And they're all in medical journals, not on some obscure whatever. So here's what it said in that article: chronic fatigue syndrome, CFS, fibromyalgia, various types of hypersensitivities, etc. So neurological manifestations is the postural orthostatic tachycardia syndrome, myalgic encephalomyelitis, which is ME, chronic regional pain syndrome, CRPS. All these are conditions that can be associated with advanced mold-related illness. Okay, so here's from another journal. DON is deoxynivalenol, which is also known as vomitoxin. It disrupts the central nervous network, that's in the brain, including the neuroendocrine and growth hormone. Neuroendocrine means the part of the brain that controls hormones. And then notably, the contamination, molds and mycotoxins has been identified in the brain of Alzheimer's disease patients. Moreover, deoxynivalenol, also known as vomitoxin, can significantly affect the normal activities of the nervous system and endocrine system, your hormones, and then cause damage to brain cells. And then here's another part where they said T2 toxin changes the cellular structure and function in the brain. Okay, so here's another one where they did studies on children. This is Tufts University School of Medicine in Boston, and it was published 6 years ago. They took a group of autistic children and had controls, meaning a group of kids who did not have, who were fine. And they did 87 of these. They tested urinary mycotoxins. No singular mycotoxin or group of mycotoxins was associated with autism spectrum disorder diagnosis in children. However, serum immunoglobulin G and IgE levels are a more reliable index of long-term exposure, and that's the test that MyMycoLab does. So, same study, the patients reported moderate to severe levels of cognitive, physical, and emotional symptoms, mostly depression. Here's a study that I was involved with, and and it was published in 2 different medical books. The study population, we took 119 patients, of whom 79 were female and 40 male, and we had 20 that were controls, that were normal. And we obtained nerve conduction velocity, NCV, studies for motor nerves and sensory nerves. So we had 55 that had both the sensory and motor nerve polyneuropathy. The ones that had only motor was 17, or only sensory was 27. But total goes up. That's the key. And this is classic CIDP, chronic inflammatory CIDP. So C is chronic, D is demyelinating, CI, chronic inflammatory demyelinating polyneuropathy, CIDP. here's one on optic neuritis that I published with 2 other colleagues 21 years ago on how to treat it. Okay. And also how to diagnose it. Now, here's another study on multiple sclerosis, and it's one of the most severe and frequent demyelinating neurological diseases, mainly affecting young people, eventually leading to their becoming disabled. This is a 210 study from Rutgers Medical School in New Jersey. We propose here that fungal toxins are the underlying cause of multiple sclerosis and thus may offer an avenue towards an effective cure. The mycotoxin, gliotoxin, causes demyelination, leading to multiple sclerosis. Now, here's the other part that's very important. And this was another study. This is from 5 years ago. Gliotoxin aggravates autoimmune encephalomyelitis by triggering neuroinflammation. And they stated MS, multiple sclerosis resolution, by antifungal therapy, not supplements, and I don't know what else. Antifungal therapy compromises a strong evidence that supports fungi, major contribution to this disease. And for those who go after the internet to all their answers instead of published studies and medical and scientific evidence, did you realize that glutathione increases the cytotoxicity of gliotoxin? So don't rush out there, everybody, and start taking glutathione. Here's another one. This was published in 2021, 3 years ago. Well, T2 toxin is able to cross the blood-brain barrier and accumulate in the brain. Gliotoxin toxicity increased in the presence of glutathione. Again, for those of you who take glutathione and you have gliotoxin antibodies in your serum blood test, stop taking the glutathione is what this is saying. Now, if they found it in your urine, it doesn't matter. That doesn't count. Urine test is not a validated test. So here's a study done on different brain, and it's titled Different Brain Regions Are Infected with Fungi in Alzheimer's Disease. Different brain regions, including the external frontal cortex, cerebral hemispheres, all these different parts reveal they were all infected with fungi, and also in the blood vessels. Okay, so exposure to ochratoxin A may induce early onset of Parkinson's disease and other neurodegenerative disorders. Here's evidence of fungal infection in cerebrospinal fluid, the CSF, and brain tissue from patients with amyotrophic lateral sclerosis. This is Lou Gehrig's disease. And they concluded our observations provide compelling evidence of fungal infection in the ALS patients analyzed. And here's another study on Lou Gehrig's disease. This effect of glutamate expression is important evidence for the role of mycotoxins in ELS, antibodies and neurotoxins in blood, cerebrospinal fluid, and brain tissue, CNS, central nervous system tissue, in samples from a large group of ALS patients. So here's another one. This is from 4 years ago. ALS is the most common form of motor neuron disease in adults. It is a progressive and fatal disease. Approximately 90% are sporadic, and 5 to 10% are due to genetic mutations, familial. So now they're saying that the sporadic form, the 90%, is caused by fungi. Okay, so That's what they're saying. Base your diagnostic testing and treatment on medical and scientific evidence, not on the opinion of so-called internet and social media experts. Okay. So what is the most accurate test for mycotoxins from molds? Which is the one that university medical centers use? What test for mycotoxins did the authors of all these studies use that I just showed you? This one. It gives you both IgG, which is a toxic reaction, and IgE, which is a mast cell activation to 12 different mycotoxins, giving you a total panel of 24 test results, and it's available internationally as well. Now, let's take a look at some of these things. Here's the latest study comparing urine and serum. So what they're saying here, and look at this, it demands daily urine sampling at different time points during the day. However, the inter-individual comparison of mycotoxins is challenging because various factors, such as gender, age, diet, and muscle mass, can influence creatinine secretion. And so they concluded the ELISA method, which is the method used by MyMycoLab, to detect mycotoxins in human serum, not urine, comes with significant accuracy, precision, and specificity. This was published in October 22, so about 14 months ago. And here's a screenshot from the end of last year. Look what the CDC says: use of unvalidated urine mycotoxin tests. Okay. And it says low levels of mycotoxins are found in many foods. Therefore, mycotoxins are found in urine of healthy people. Well, let's take a look at that. By the way, it's important that you retest the blood test after 6 months of treatment. This is a slide that Dr. Vojdani graciously allowed me, sent to me and allows me to use. He gave this at the A4M conference in December of 2023, last month. And this is an example of people not understanding really how labs work. So they took, in this article, and the research article is on top, it's in Access Microbiology, stools from healthy persons were screened for different bacteria and parasites. Then they spiked them with 14 bacteria and 2 parasites, sent to 2 different labs. On the right, it was specific only to 26%. That means 74%, 3/4 were no good, gave wrong test results. Okay? So be very careful with these, where you order tests from. And he continued. This is also from another study, and Dr. Vojdani put this up. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi, but most of the microbial markers on these tests do not measure what they claim to. Don't use the organic acid tests. And he concluded his lecture a month ago. Look for body burden of chemicals, mycotoxin antibody, not chemicals coming out of my urine, like mycotoxin in urine. This is a famous fountain in Denmark, I believe. So I want to show you what a person's test may look like, and they're sick. Look at the symptoms: fatigue, anxiety, memory disturbance, easily confused, depression, sleep disturbance, etc. Muscle aches, joints, abdominal pains, night sweats, impotence, frequent canker sores, thyroid inflammation, multiple sensitivities. This one on the left is IgG, on the right is IgE. So really, this is pretty chronic toxic reaction. Here's another one. Again, symptoms: fatigue, confused easily, mood swings, headaches, numbness and tingling, blurred vision, ringing in the ears, severe muscle weakness, intolerance to bright lights, muscle and joint aches and pains, decreased mobility, sores that won't heal, bruises easily. And you see, you don't have to have them all the way in red. This is enough. The left is IgG, the toxic reaction, and on the right, IgE, which is a mast cell activator. It activates your mast cells and can lead to mast cell activation syndrome. In treatment, let's get to treatment. And there's so much more, folks, but I could keep you here. Actually, I gave a course on this part of brain. It was the entire morning from 8 to 12 at a medical conference. So first and foremost, follow the first rule of toxicology. Get the patient away from the toxin or the toxin away from the patient. And I believe this is probably the most effective, but also the most difficult thing to do. Second, a person's health cannot be restored if they continue to be exposed to molds and mycotoxins. And treatment will not work under those conditions. I use itraconazole. Okay, it's also known as Spornox, common antifungal agent that was developed in the 1980s. This study was published in 2017. Back then it was 35 years. Now there's 7 more years. It's 42 years with an established safety record. And I get emails, oh my God, I read on the internet that, your eyeballs are going to fall out, your teeth are going to fall out, your liver's going to get completely destroyed, your kidneys are going to, I don't know what, your hair's going to fall out. No, forget. Here's another study. This is a more recent one. Itraconazole is a broad-spectrum triazole antifungal agent. It has favorable pharmacodynamic and pharmacokinetic profiles and is available both orally and intravenously. Itraconazole is proven to be a valuable addition to the antifungal drugs currently available for treatment. Itraconazole has been well tolerated with doses of up to 400 milligrams per day, generally free of serious adverse effects. Now, in my patients, I give them 100 milligrams twice a day, so only 200, but I could double that and they still would not be affected. So, and here's another thing. Oh, I'm taking fluconazole, diflucan. Great. That's great for single cell molds. It's not going to help any in multiple cell molds. So what are single cell molds? All the yeasts. That's it. Not anything else. What are all the multiple cell molds? Well, Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium, etc., etc. So folks, I mean, yeah, you can try the diflucan, but it's not going to do very much at all. Okay. Now, let me go on to a little further. Supplements. This is a new study. 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients that are listed on the label. 40% did not contain a detectable amount of the ingredients at all. So folks, especially you poor folks that have to take 20, 30, 40 different supplements, my gosh, I've never used that much in all my career. Anyway, 40% did not contain a detectable amount of ingredients at all. I am so careful to get my supplements from the best companies. So here it goes. I give phosphatidylserine. Then this healthcare practitioner I'm talking to says, well, why not choline? said, well, you know what? Go to PubMed, which is the National Library of Medicine, and look things up. Don't look them up in Dr. Google. Look them up in medical journals. What does it say in the medical journals? That the oral phosphatidylserine supplementation has been studied in double-blind, placebo-controlled, randomized clinical trials. That's the gold standard, folks. It enriches myelin. Remember that mycotoxins demyelinate. You lose myelin. This one enriches it, enriches the myelin. Influences the metabolism of neurotransmitters, acetylcholine, norepinephrine, serotonin, our happy neurotransmitter, and dopamine. A lack of dopamine is ALS. It's Parkinson's. Leads to Parkinson's. Stimulates enhanced performance on task that test learning ability and short-term memory. Compared with the effects of placebo, which was ineffective, phosphatidylserine supplementation produced significant improvements in short-term recall, immediate memory, vocabulary skills, and ability to recall words, attention, and vigilance. Got that? Those who think choline, phosphatidylcholine should be given. Melatonin. These are from studies from University of Texas, San Antonio branch. Melatonin reduced cellular damage generated as a result of toxic agents. Okay? These protective effects are apparent when melatonin is given as sole therapy or in conjunction with other potentially protective agents. So it protects neurons. Neurons are brain cells from molecular damage due to a variety of substances, including mycotoxins. Now, don't go out there and buy 20 and 30 and 50 milligrams of melatonin. B complex. This is a group of 8 water-soluble vitamins. Okay? Their collective effects are particularly prevalent to numerous aspects of brain function, including energy production, the repair and synthesis of DNA and RNA, genomic and non-genomic methylation, the synthesis of numerous neurochemicals and signaling molecules. Furthermore, evidence from human research shows that a significant proportion of the populations of developed countries, and we are in a developed country, suffer from deficiencies or insufficiencies in one or more of this group of vitamins. And that in the absence of an optimal diet, administration of the entire vitamin B group rather than small subsets at doses greatly in excess of the current governmental recommendations would be a rational approach for preserving brain health. This is why I use the entire B complex. Magnesium, 11th most common element in the human. This master mineral, and I published an article on magnesium 10 years ago, is a necessary ingredient for approximately 350 enzyme systems, thus playing a role in the majority of the body's metabolic process. Up to 80% of the population are deficient in this nutrient, okay? And magnesium binding sites have been detected on 3,751 human proteins that are essential for building, repairing, and maintaining your body's cells. Important information. Magnesium is a cofactor for a substance known as adenosine triphosphate, ATP, which plays a role in energy metabolism, the processes by which the body breaks down proteins, carbohydrates, and fats, and converts them into energy. So ATP is the energy currency of the cell, the primary product made by mitochondria. Magnesium is a requirement for this part. And magnesium is also required as a cofactor for vitamin C. Vitamin C is one of the body's most important antioxidant nutrients for support of the immune system. Okay? Magnesium is also a cofactor for other nutrients, including zinc, potassium, B complex, calcium, and vitamin D. Without magnesium, it would be difficult to absorb and use these necessary substances. By the way, just so you understand, vitamin C, we neither make it nor can we store it. So this is why I give my patients high doses of vitamin C. Let's go to vitamin D. It can be very helpful in cognitive impairment, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or brain cell death. Low vitamin D levels are associated with increased cognitive impairment, diabetes, cardiovascular diseases, cancer, and respiratory diseases. Omega Q plus max, that was promoted by my late friend, Dr. Steve Sinatra. It contains DHA and EPA from squid. Why from squid? Because fish oil from fish livers can easily contain mercury, but not squid. L-carnitine, necessary for heart function and cardiovascular health. Curcumin, which is a wonderful anti-inflammatory, as is the last one, resveratrol, that comes from the skin of red grapes, and coenzyme Q10 for the heart. Now, here's something that I'm asked, should I stop eating this and that and the other foods because they can contain mycotoxins? So they did this study. Look at the last 3 lines, okay? An adult with a body weight of 170 pounds would have to consume 14 pounds of ready-to-eat contaminated oatmeal or 20 slices of contaminated bread to exceed the RFD factor, which is the factor that indicates poisoning from mycotoxins in food. And here's another one, binders. Oh, take this binder for that binder for this, blah, blah. So what did they do? Binders rely on the absorption of mycotoxins in the gut, preventing it from getting into the blood. Included are kaolinite, clays, activated charcoal, zeolite, bentonite, etc. They're effective in neutralizing only one mycotoxin, aflatoxin, and aflatoxins don't grow indoors. They are ineffective in all other mycotoxins. In addition, they bind vital vitamins as well as macro and micro elements, regardless on how far, wait 4 hours or wait 6 hours or whatever. It doesn't work. Okay? This is published study. This is not internet talk. Now, this is a great screening tool. This is 2 pages. On the left, you say, how bad is it? And it starts with fatigue at the top. It goes through 2 pages of symptoms. And on the right, it says, when did you first notice this symptom? Very useful. I developed this like 30 some odd years ago. Now, at the top, that's my email address. And if you want any of these studies, molds, mycotoxins, the brain, the gut, and misconceptions, or molds, mycotoxins, and their effect in children, Lyme disease and mycotoxins. How can you tell between each one? And this one, environmental triggers and autoimmunity in autoimmune diseases. So all of these, let me know, just shoot me an email, and I'll send these to you. Okay, folks, that's it for this evening. I'll see you a week from now with Tea Time, where you can put in the chat questions about Lyme, about heavy metals, about fibromyalgia, chronic fatigue syndrome, molds, mycotoxins, anything you want that's medical. Okay? All righty, folks. Well, have a good one and all the best to you, and see you next Wednesday.